Right, the COBRA study that I will be presenting here at EHA tomorrow is a single-arm phase 2 study of newly diagnosed patients with advanced stage Hodgkin lymphoma. And it's kind of a supplement to the HD21 study, which will also be presented tomorrow at Sunday at EHA. COBRA wanted to bring together the two most important developments in the treatment of Hodgkin lymphoma in the last 20 years. The first one was the PET response adapted treatment. Second one, introduction of novel agents. The first novel agent to make it into first-line treatment was Brentuximab vedotin. That happened with the Echelon-1 study where I presented the 7-year update yesterday. Echelon-1 showed that Brentuximab plus AVD chemotherapy was more effective than ABVD chemotherapy. There was also a PET scan performed after 2 cycles, but it didn't influence treatment. We didn't like that in the ORCC group, so we designed the COBRA study. In COBRA, all patients had A plus AVD to begin with, so that was the experimental superior arm of Echelon-1. After 1 cycle of treatment, that's 2 treatments, a PET scan determined whether they would continue with that treatment in case of PET negativity, or in the cases of a positive PET, and that was 30% of patients, or more than 30% of patients, they would escalate or intensify to BRCAD, which at that point was still an experimental regimen, but which now with HD21 has proven to be safer and even superior to BRCOP, which hitherto has been the most effective regimen in advanced stage Hodgkin lymphoma. And what we show is that unlike in Echelon-1, where the early PET positive patients continuing with A plus AVD had a 3-year progression-free survival of 69%, in COBRA they shift to BRCAD and they have a 2-year progression-free survival of 91%, which is not only better than the historical comparison of 69%, it's actually also better than the 2-year progression-free survival of the early PET negative patients who continued with A plus AVD. So the overall results is around 90% 2-year modified progression-free survival, and we call that a positive study according to the assumption made prior to the opening of the trial.